The nurse is treating a patient with heart failure. Heart failure means the pump ain't working. Upon examination, the nurse observes that the patient is short of breath and crackling sounds can be heard during auscultation. If the patient has an excessive fluid volume, what other symptoms would the nurse expect to see? So we have excessive fluid volume because of heart failure. The heart, is not pumping fluid to the body. It's getting backed up into the lungs. So it goes back into the lungs. That causes shortness of breath and causes the crackles. That's the fluid. So what would you see? Weight loss and dry skin. You're full of fluid. You have excessive fluid volume. You're not going to be weight loss and dry skin. You're going to be wet and heavy. No dryness, no weight loss. Elevated blood pressure and increased breathing rate. That can definitely happen. What's happening is the pump isn't working. It's not pushing fluid out into the body. Fluid is backing up into the body. It backs up into the venous system. So you have more liquid in the circulatory system. So definitely elevated blood pressure because more fluid, and increased breathing rate because you can't breathe because there's fluid in your lungs. Flat neck and hand veins and decreased urine production. No, you have a lot of fluid. You're trying to pee out stuff more, so you're not going to have decreased urine production. You're going to have increased urine production. Flat neck veins and hand veins. Remember, the heart arteries go out of the heart and veins go into the heart. If you have heart failure, the pump is not pushing the right way. It gets backed up into the veins, so then these guys get engorged. The veins get bigger. So they're not flat. They're big. And you pee a lot of the fluid. Weakness and low central venous pressure. Weakness, possibly, but low central venous pressure. We talked about the veins. They get bigger. Definitely not. Weakness, there's many reasons of weakness, but that's not the only reason. So, best answer, elevated blood pressure and increased breathing rate. Remember, heart failure. The pump isn't working. You're wet and you're heavy. The nurse is reviewing a patient's medical records and determines that the patient is at risk of having potassium deficiency, low potassium. Remember, potassium normally is 3.5 to 5. So we're talking about somebody less than 3.5. And is at risk of having a potassium deficiency if which of the following conditions is documented? Persistent tissue damage? No. All our cells are bags of potassium. If the tissue is damaged, they release potassium into the blood, and then our potassium levels will go up. So persistent tissue damage will not cause low potassium. It actually causes high potassium. Has a past diagnosis of Addison's disease. In Addison's disease, I need to add aldosterone. I don't have aldosterone. What aldosterone normally does is it goes to the kidney. It goes to the kidney and tells the kidney, hey, save sodium and waste potassium. So make sodium higher and waste potassium. But here in Addison's, we don't have aldosterone. We're missing it. So it actually becomes backwards. If you have Addison's disease, you get low sodium and high potassium. So we don't need this. We're looking for low sodium, so no. Needs nasogastric suction. Yes, your belly is full of potassium. All that stomach is full of potassium. You suction things out, you're going to lose potassium. Remember, the belly's full of potassium, so that will actually make you lose potassium. So that sounds good, but let's see the next one. Uric acid level of 9.5. So that's a high uric acid. Uric acid is like 3 to 9, about 3 to 9. Here we're 9.5, so we're actually a little high. Remember, the cells are bags of potassium. They also have a lot of uric acid. So if you have a lot of uric acid, it probably means your cells got damaged and you probably have a lot of potassium. So, no. That you would have high potassium. So, best answer, needs nasogastric suction. That'll lose the potassium from the stomach. The nurse is reviewing a patient's electrolyte lab results and notices that the potassium level is 2.6. That's low. Remember, normal is 3.5 to 5, so we're on the low end. What changes would the nurse expect to see on the patient's electrocardiogram, ECG, due to this laboratory value? So basically, what happens when you have a low potassium? Missing P waves? No. That's seen in AFib. All right, that's in the AFib when you have that irregular rhythm. You get missing P waves. All right. Lowered ST segment. So ST segment depressions, yeah, you can see that. The potassiums have a lot of things to do with making the S, the T's, and the U's funny. So remember, the S, the T's, and the U's get funny with the potassium. So lowered ST segment, yeah. Reverse T waves, yeah. Upside down T waves, yeah. Inverted T waves, yeah. U waves, yeah. The U wave, remember the EKG, it's a P. That's the P. Q, R is always on the top, S, T. And then if you have an extra one, that's the U wave. That's in low potassium. P, Q, R, STU. That's an EKG, and this is the QRS complex. Don't forget that. So a lot of stuff happens with the STs and the U's with the potassium here. Okay, over here. Next one, widened QRX complex. That is seen in high potassium. The high potassium kind of stretches the EKG, makes it wider, so you get wider QRS complex. Nah, so none of that. So low potassium, a lot of STU changes right there. All right, a client with heart failure. Heart failure means the pump ain't working. Fluid's backing up into the lungs. Who is experiencing hypokalemia is prescribed potassium chloride intravenously. So the patient is having low potassium, and they're prescribed potassium chloride intravenously through the IV. What steps will the nurse take in preparing and administering the potassium? Administer the medication as a bolus. Yeah, if you hate your patient and want to kill them, you'll definitely do that. Remember, potassium has been used in the past to kill people, to stop their heart. So no, absolutely not. You want to kill your patient? Sure, go to jail. Acquire an intravenous IV infusion pump. Yes, you need a pump to pump potassium because it is deadly. It can cause death. So you need an IV pump. Observe urine output during administration. Absolutely, you want to make sure that the patient is peeing because you don't want these potassium levels to increase and cause their heart to die. Remember, potassium can cause cardiac problems. Sodium causes CNS. Let me believe the S sounds like a C there. Cardiac, potassium, cardiac, sodium, CNS. That's really supposed to C, but we'll make it sound like an S. All right, so observe urine output during administration. Absolutely, potassium is deadly. Watch for signs of infiltration for phlebitis. So at the IV site, so inflammation, irritation at the site. Absolutely, potassium irritates. So you want to do that too. It doesn't feel good. Make sure the medication is mixed with the correct volume of fluid. Absolutely, you want to make sure you got the right dose. Remember, this is a deadly mixture. Label the bag with the volume of potassium in the solution. Absolutely, make sure it's labeled. Potassium is deadly. So all these guys right here. Acquire IV pump, observe the urine, watch for signs of irritation or inflammation at the vein. Make sure it's mixed correctly and label the bag unless you want your patient to die. All right, the nurse is evaluating a patient with lactose intolerance who is suspected of having hypocalcemia. Lactose found in milk and dairy. They're not getting it because they're intolerant, so that probably caused their low calcium. That's probably what they're getting at here. Which symptoms would the nurse expect to observe in this patient? Decreased bowel sounds. All right, so let's first go over what happens with low calcium. Low calcium actually excites the CNS, so it'll actually make you more excitable. Your CNS stuff, your nerves will actually get more excitable. So decreased bowel sounds, probably not. The nerves in your bowels will go faster, so no. Remember, low calcium excites. Negative Trousseau sign. What's a Trousseau sign? You get a patient, put their arm, put a cuff around it, the blood pressure cuff, you pump it up, their arm will start going back and forth. Their CNS is more activated with low calcium. But you would have a positive Trousseau if you had low calcium, so this is wrong. Muscle twitching, yeah, you'll have that. Why? Because the nerves are more activated. Remember, low calcium activates the nerves. Muscle twitching, the muscles will twitch. Decreased deep tendon reflexes, no, they'll be increased. Remember, low calcium likes to excite the nerves. So you'll have increased deep tendon reflexes. Don't forget that low calcium excites the nerves. Muscle twitching is your answer. The nurse would look out for the following on the ECG of a patient with Crohn's disease and a calcium level of 7.9. Normal calcium is like 9 to 10.5. So we have low calcium, hypocalcemia. What happens in the heart with hypocalcemia? A lot of the stuff likes to extend, like the intervals and the segments, they like to extend with the low calcium. So let's see what's going on here. Peak T waves, no, that's seen in high potassium. High potassium causes peak T waves in high potassium. So no, longer QT interval. It'll extend the QT interval. That sounds pretty good to me. Let's see what the next one says. Widened T waves. No. A lot of that stuff is like potassium is the T wave, the T thing that messes with the T waves. Extended ST segments, so segments, the intervals in the segments with the calcium, with the low calcium. Yeah, I can definitely see that. Prominent U waves, that's seen in low potassium. Remember the U wave? Here's your P wave, EKG Q, R, S, T, U. So we'll label this P, Q, R, S, T, U. You just keep going in different directions. P is on top, Q is on bottom, R is on top, S is on bottom, T is on top. And then the U wave is only seen in low potassium. So The only ones that mess with the intervals and the segments are with the calcium are the extended ST segment and the long QT. This is seen in low potassium need prominent U waves. Got it. All right, so the nurse will monitor the cardiac monitor closely for the following patterns due to the patient's potassium level of 5.8 with chronic kidney disease. Remember, normal potassium is 3.5 to 5, so we have hyperkalemia here. And chronic kidney disease 2, so their potassium from their crappy kidney is not being eliminated. It's actually staying in the body. So potassium is going up in the body. It's going up. All right, so quieter QRS complexes. So that sounds pretty good. I'll go over that though, but let's keep going. ST depressions, not typically seen with high potassium. No, ST depression not seen with high potassium. Tall and pointed T waves, that can be seen with high potassium. Let's go to the next one. Conspicuous U wave. That U wave is seen in low potassium. Low potassium. Remember the U wave. Remember, you go up and down, up and down. P, Q, R, S, T, U. That's a low potassium. Prolonged ST segment. No, that's not typically seen with high potassium. So what happens with high potassium on an EKG? Imagine you have your EKG like this one right here. High potassium, what it does, it actually stretches it out. You wouldn't have a U wave in high potassium though. High potassium, imagine you make things taller and you stretch them out. So you would, imagine if I was pulling this paper. So I would have a wider QRS complex. The QRS complex is this guy right here. This guy. So he'll get wider because I'm pulling him. And the T wave will get taller because I'm pulling the paper up. So definitely wider QRS complexes and taller pointed T waves. Don't forget that about the high potassium. And don't forget the kidney is supposed to eliminate potassium. Chronic kidney disease, crappy potassium, you ain't going to eliminate the potassium. Watch out for the heart. Remember, potassium, cardiac problems. Cardiac with a K. Kim Kardashian style. Sodium, CNS. But that's really a C, but it sounds like an S. CNS problems. Brain problems.